Getting urinary tract infection sucks. You know what sucks more? Getting it over and over and over again. Believe me, I've been there. It almost looks like your life is just about urinating. You're constantly thinking about pee. The sight of the bathroom scares you. It feels like you spent half of your life in the bathroom. It's either you're thinking about it, it's either you want to stop it. Does that sound like you? If it does, then you might want to continue watching this video to know more about chronic UTI, the causes, and how to prevent them, how to manage them. UTI is an infection that happens in any part of your urinary tract. It usually starts from the bowels and it's driven down to the urethra where the urine comes out from. But if left untreated, it can also migrate back up the urinary tract. So we have the lower urinary tract infection and the upper urinary tract infection. It can spread from your urethra, which is the hole through which the urine passes through. So it can spread from the urethra, go up aside to the ureter, to the bladder, and even the kidney itself. You know, if UTI is left untreated, it can become more serious and life-threatening. So we need to do something about UTI before it spreads and then causes more issue. It becomes chronic if you've had it at least twice in 6 months or at least twice in a year. Some of the symptoms you can have if you have UTI includes a strong urge or sensation to pee, cloudy pee, when you pee in small amounts but more frequently, and then a burning sensation when you pee. If you have colored urine like red, bright pink, brown urine, sometimes you can also have pain in your pelvic bone in the front. Those are signs of UTI, chronic UTI. And if the infection spread has got into the kidney, then you can have things like nausea, vomiting, feel dizzy. Those are signs that the infection has spread from the lower urinary tract and has gotten up to the kidney. Knowing the why is very important. Why do I keep having UTI? Why does it keep coming back? Once you can identify the reason and work towards eliminating it, then can reduce your chances of having UTI. Obviously, there are some causes that we can't do anything about. One of such causes is being a woman, having a vagina, the position of our vagina close to our urinary system. The vagina is so close to the urethra, and bacteria can migrate from the vagina to the urethra, and then it can spread from there. We can't do anything about being a woman. Another of such cause is genetics. Some people, even with impeccable hygiene, are still more prone or are still prone to having UTIs, and there's nothing that can be done about that. But there are also other modifiable causes that you can work towards, get better at, and can reduce your chance of having UTI. One of the causes is tight pelvic floor muscles. I know, as a physiotherapist, I know the general knowledge is, oh no, you need to do Kegel exercises, you need to tighten your pelvic floor muscles, you need to strengthen your core muscles. Yeah, it's fine. They have the advantage, but it can also lead to you having chronic UTIs. Because what the pelvic floor muscle does is like a sheet of muscle, and that is the muscle through which the urethra passes through, the vagina passes through, the anus, the inner opening passes through. If the muscles are too tight, they can compress the opening of the urethra and limit the flow of urine that comes out. That way you're passing urine out slowly and the bladder is retaining more urine, and infection can spread because it's retaining urine for a longer time, and that can be the reason why infections are spreading and you keep having UTIs. So if you have a tight pelvic floor muscle, what you will need to do then is not to keep doing Kegel exercise. What you will need to focus on is to relax the pelvic floor muscle. So it's just about knowing what caused it. Do you get? If it is a tight pelvic floor muscle, you just be doing Kegels and you make it worse. So for that, you would have to do relaxation exercises to relax the pelvic floor muscles. I'll talk about pelvic floor muscle relaxation in another video. Vulvar care. The vulva, the vagina close to the urethra, any infection that starts there, bad bacteria can easily migrate to the urethra. So you want to take care of your vulva well to prevent that. And that's why there is this popular information that when you want to wash, ensure you're washing from the front to the back, so you're not bringing bacteria from the vagina to the urethra. So wash from the front to the back. Another thing is lubricant. When you have to use lubricant, use water-based or water-soluble lubricant. It's because harmful chemicals in the lubricant can disrupt the pH of your vagina and breed bacteria. So water-based lubricant. Do not wash your vulva with soap. The vagina itself is self-cleansing. It doesn't need you helping it. So don't wash with soap, because soap can also disrupt pH, can lead to more bacteria and migrating to the urethra. Another is laundry, the laundry of your undergarment. Ensure that you're not using harmful soaps to wash your pants, your underwears in general, because those ones are in constant contact with the vulva. So ensure that when you wash your undergarment, you use mild soaps, and ensure that you are sun drying your undergarment before you wear them. Also, for vagina and vulva care, immediately after sex, ensure you pee, and that pee would help to wash away bacteria that might have moved up during the sexual act. So immediately after sex, ensure you pee. The third reason is dehydration. If you don't drink as much water, your urine becomes acidic, and bacteria thrive more in acidic environments. So that might be the cause of your chronic UTIs if you're not drinking enough water. So if you drink enough water, your urine becomes less acidic, you're voiding more, and that can reduce your chances of the occurrence of UTI. So you need to drink more water. You need to drink more water. The fourth one is constipation. If you are easily constipated, that might be the reason why you keep having UTIs. What constipation does is it puts a lot of pressure on the bladder and affects the voiding capacity of the bladder, and you retain more urine, and that can breed infection. So you need to work on constipation, and how you can work on that is your diet. Obviously, drinking more water, including more vegetables, more fruits into your diet. That way you're voiding easily, and the stress, the strain on the bladder is reduced, and you void more urine. That can also lead to reduction and the reoccurrence of UTI. The last one is stress. Obviously, being overwhelmed doesn't directly mean that you would have UTI, but increased stress can increase the level of cortisol in your body, and cortisol has an adverse effect on organs in the body, in which the bladder is not exempted. So if you keep exposing yourself to a lot of stress and you're not managing stress effectively, it can affect the functioning of your bladder. Can make you retain urine more, breed infection, your immune system not working properly as they ought to, and that could be the reason why you keep having UTI. So you need to look for a way to manage stress. I recommend journaling. I recommend meditation. I recommend you finding a hobby and you making a decision to be happy. Sometimes it's as easy as that. That brings me to the end of the video. I hope you've learned one or two things. If you have any questions, you can put them in the comment section, and if you know any other cause, any other thing to do to prevent UTI, you can also put them in the comment section. I'll be there. I'll be answering your questions and responding. Till next week, keep living your best life. Bye.